I'm Dr. Thomas Noonan, an acupuncturist here at the InSpa Community Acupuncture. I'm here with our friend Fred. He's been kind enough to demonstrate what it's like to be a patient here at our clinic. And this is Fred's first time at the clinic, so we're going to ask him a few basic questions before we start with the procedure. So what brings you into our clinic today, my friend?
I came in today for some lower back pain I've been experiencing.
Okay. Sure. Well, we could certainly help with that. How long ago was the injury?
It's an ongoing issue. The original injury happened around 10 years ago, but it's not something that hurts all the time. It just flares up when I move wrong or attempt to lift something. It really, comes on strong, and it's really, really painful.
Okay. Have you tried anything to help with the pain?
I've seen doctors. I kind of have an aversion to taking pain medication, so it's kind of one of those things where I just deal with it.
Okay. Well, let's have you lay on the table so we can take a feel of the back there and see exactly where the spots are, where the pain is, and we'll move forward with the treatment from there.
Perfect.
Before we start anything, I'm just grabbing an alcohol pad, and we're going to clean the areas where we're going to needle. And so when you've had acupuncture in the past, even though it hasn't been for lower back pain, have you had any sort of aversion to the needles in any way?
No, it's one of those things where when I've chosen to do acupuncture as a treatment, the things I was experiencing far outweighed, any sort of fear of needles or getting poked. It just, I wanted some relief, and acupuncture has helped me in the past. So
So you let me know if any of these do bother you, and we are going to begin with some needles at and surrounding the area where you stated there was pain, and this is going to help treat the pain by tricking the body into thinking that this needle is something that the immune system needs to deal with, and so as a result the body will circulate our blood, which has our nourishing cells, our cleaning and killing of bacteria cells, as well as our platelets, or our rebuilding cells. And so the combination of those being brought to this particular tissue will make that tissue stronger and thus more relaxed. And do these feel all right in your back right now, Fred?
yes.
All right, excellent, sir. Are you comfortable with the needles as they are right now?
Yeah.
All right, excellent. So we'll let you rest here with these needles for about 30 minutes total, and I will come to check on you in about 10 or 15 minutes and just make sure that everything is okay. If there's nothing else I can do for you, Fred, then I will step out and let you enjoy some rest and relaxation.
Perfect.
All right, my friend. Enjoy then, and I will see you shortly.
So how was your treatment?
It was good. Yeah, I definitely feel better than I did when I walked in. I don't know, it's hard to describe, but I mean, every time I've gotten acupuncture afterwards, you kind of get that feeling of well-being. Like after a good massage, you just sort of feel better.
So are you going to come in again?
Absolutely. Yeah, I'm sold. Acupuncture is something I'm trying to work into my routine, at least, weekly. I'm drawn to the holistic approaches to treating ailments, and so it just makes sense for me, my lifestyle, to sort of work acupuncture in as treatment for, various things that I deal with.
So you would recommend it to family and friends?
Yeah, I've been trying. That's the goal, is to get people turned on to holistic approaches to a lot of the things that we all deal with. You know, I definitely suffer from a lot of different things that I know acupuncture can help with and has helped with. So, yeah, like I said, I'm trying to work it into my schedule and get in here as much as I can.
So did it hurt?
No, you know, it hurts less than, you know, definitely less than like getting a shot when you go to the doctor. And like I said before, the things that I was coming in for were a lot harder to deal with than a quick little poke of a tiny little needle. Yeah, it didn't hurt at all.